So we're leading one of the work packages for the project, which focuses on how responsive the health services and systems are in the study countries to the mental health needs of Syrian refugees. And so that involves a number of different research methods. So one of them is what we're calling rapid appraisal method, which is really a fairly quick and simple way of collecting existing data and information and then doing some additional interviews with experts and so on to really unpick how well, in this case, Syrian refugees are able to access the care they need. So we look at it from what we call a person-centred approach. So for example, imagine you're a Syrian refugee in one of our project sites, for example in Istanbul in Turkey. How can they access the care they need to support their mental health needs? So that may be navigating health services, it may be getting extra support services, and what are the things that help them get that care, or what are the barriers that they face? So we want to understand all of those things better using existing information and reports and so on, and then doing some additional interviews with Syrian refugees, healthcare providers and experts as well. Some of the other methods we're using in the study involve doing large surveys at the community level in 2 sites. So one of them will be in Istanbul and another one with Germany. And so those surveys will be with Syrian refugees. In the case of Istanbul, about 2,000 refugees randomly sampled from an area in Istanbul where many Syrian refugees are living. And we want to understand the burden of mental disorders amongst those Syrian refugees, and also their ability to access care, the types of services and health services they're using in Istanbul, and some of the barriers that they may have faced in accessing that care, so we can better understand at a population-wide level what those barriers are, and then how we can better support overcoming those barriers. What we're also doing in this study is more qualitative research, so that's interviews with experts such as healthcare professionals, academics, policymakers, and also Syrian refugees and people that may be caring for them if they have mental health needs. And so that's really to understand in more depth the particular issues they face, but also how the services that are being provided through the strength study may support getting access to better care. And so we want to look at, through these methods, how the services and programme of work through the strength study may be able to be expanded and scaled up in the study countries to increase the ability of Syrian refugees to get the care that they need and deserve. We definitely hope that the findings from our research at all stages of the research over the next 4 years that are left of the project will be useful for other organisations in other settings, particularly those working with Syrian refugees, but potentially also other refugees, where some of the findings would be useful in the settings that they're working, so I think that would be of value as well. But also the methodologies that we're using, so this is really for other researchers at universities or, for example, non-governmental organisations that are also doing research. They could use the methods that we're using, some of the toolkits that we're using, and they could apply that in their settings to get the information that they need in those particular settings. What we're also doing as part of our work is what we're calling theory of change workshops, which are really ways of understanding how programs of work are being implemented and understand that better to hopefully reach the goals that we would like at the end of that program of work. But it can also be expanded to be looking more broadly at how do we achieve a goal of, for example, better access to mental health services for Syrian refugees. And these theory of change workshops are a way of trying to understand the ways in which that could be achieved, some of the barriers that may be faced, to unpick all of these aspects, to take them into account in order to help achieve that end goal of improved access or improved health outcomes among Syrian refugees, and be able to measure and plot that along the way, that progress. And that involves working with a number of different agencies and partners, so that would include members of the Strength team, but also people from the Ministries of Health, from other non-governmental organisations and so on. And so through that process, that the information that we would get through that process would also be of benefit to those other partners and stakeholders.